Good morning, everyone. My name is Anand Parikh, and I'm the Chief Medical Advisor at the Bipartisan Policy Center. And I want to welcome you to today's event entitled COVID-19, Forecast for the Holidays and 2022. Today's event is part of a series of activities at the Bipartisan Policy Center to help inform the public and policymakers of the response of COVID-19. Recently, our Future of Healthcare Task Force at BPC released a report with recommendations related to immediate actions that the Biden administration and Congress needed to take to tackle COVID-19. They also released a report focused on positioning the public health system for the next pandemic. Today's event is two parts. The first part is a recently recorded fireside chat between Dr. Tony Fauci, President Biden's chief medical advisor and director of the National Institute for Allergy and Infectious Diseases, and Senator Bill Frist, former Senate Majority Leader and BPC Senior Fellow. After that pre-recorded conversation, I'll moderate a discussion with Dr. Leana Wen, visiting professor at George Washington University and former Baltimore City Commissioner of Health, and Dr. Jerome Adams, Executive Director of Equity Initiatives at Purdue University and former US Surgeon General. Following that moderated discussion, we'll make sure to get to some questions from all of you. So please feel free to enter your questions into the chat or engage with us on Twitter, hashtag BPC Live and handle BPC_bipartisan. So without further ado, and with that introduction, I'll now turn it over to Senator Bill Frist, who will get the program started. Thank you.
Thank you, Anand, for that introduction, and to the BPC for its important efforts. I'm excited to be sitting down today with my longtime friend and colleague, Dr. Anthony Fauci. Tony, it's great to be with you once again.
Thank you, Bill. Good to be with you. Thank you for having me.
Tony, we don't have a lot of time today, so let's jump right in. Let's start big picture. What is your overall impression of how we're doing as a country right now with respect to COVID-19?
Well, in general, we're doing well, Bill, but it's a little bit of a mixed bag, and let me explain. You know, we went through a significant surge, which has come back down, and the deflection of the curve looked good. The surge was related to the appearance of a Delta variant, which is a very formidable virus in that it transmits very, very efficiently. The vaccination program has worked quite well in many respects, so we've been able to turn that around. The only thing that's a little bit disconcerting is that we're beginning to plateau. In other words, the deceleration of cases is now plateaued, and in some areas of the country, we're starting to see a bit of an uptick. With regard to vaccinations, although we've done well in many respects, we have 85% of our elderly individuals fully vaccinated and 98% with at least one dose. We have, 75 to 80% of adults have received at least one dose, but we still have about 60 million people in the country who are eligible to be vaccinated who have not yet gotten vaccinated. And that's excluding the 28 million children from 5 to 11 who we've recently now have authorization and recommendation to vaccinate. So there's a lot of good news, but some challenging news that we really need to address as we go into the winter months.
Tony, as we look into the crystal ball, jumping ahead to 2022, we're clearly still in a pandemic now. When will we evolve to more of an endemic environment? And also a little bit, what is an endemic environment? What can we expect in 2022?
Well, let me start with your question about the definition, Bill. So endemicity means it's out of the pandemic mode. You're not having a situation where it's very dramatically impacting everything we do, which it has. And that's not only us, that's the entire rest of the world. When you have a deceleration and you get below the pandemic phase, that means the virus is still present, but it isn't overwhelming the system of healthcare. It's not disrupting our normal social interactions and our economic interactions but it hasn't disappeared. The trick is, what level in that bracket of endemicity are we going to wind up at? Are we going to be at a very, very low level where we barely even notice it, sort of like those kind of infections in the community that are there? It makes a few people sick, but it doesn't impact what we do. Or is it going to be high enough that we're always going to have to be careful that we're going to get a resurgence? Obviously, the optimum would be get so low that we can start to really return to what we feel is as close to normal as we can. When we get there, apropos of your first question, is going to depend entirely on us, how well we vaccinate the public, how well we get boosters to people, because we know that the vaccine efficacy clearly wanes. We know that from our own country. We know that from more intense experience in Israel. If we can get most of the people who are eligible to be boosted, we can go a long way to making 2022 much more of a normal year than what we've seen in 2021.
Tony, you really touched upon it, but introduce into the equation children. We've got vaccinated people eligible for boosters. We got unvaccinated adults. How do the children aged 5 to 11 add to the equation?
Well, there's 28 million children in that age group. It is absolutely true, Bill, that children who get infected generally do not get a serious disease as an adult, particularly an elderly adult. But as we know, children are really quite susceptible to being infected. Even though about 50% of them get no symptoms, you still can have some serious illness. There have been now about 2 million children from 5 to 11 who've been infected. There have been anywhere between 65 and close to 100 deaths among that group, over 8,000 hospitalizations. So it isn't a trivial disease in children, but also, given the size of that cohort, to get them protected would have an impact on the dynamics of the outbreak. The clinical trials have been pretty clear, Bill. The efficacy in children 5 to 11 is 91% with the mRNA Pfizer vaccine, and the safety profile is really quite good.
Tony, let's look global. An issue that you and I worked on 20 years ago was PEPFAR, and PEPFAR has been a signature example of strategic health diplomacy, the idea that the United States should work and help other countries because it's the right thing to do morally, from a health standpoint, from a national security perspective. In that same vein, what more needs to be done with respect to COVID-19 internationally? And what is our responsibility as a country, in your opinion?
Well, Bill, I haven't changed in my strong feeling that you and I shared, as you say, 20 years ago, when we were putting together the PEPFAR program. I believe we have a moral responsibility as a rich nation to be able to extend ourselves and get interventions that are life-saving to those low and middle income countries that don't have the resources to do it themselves. So what are we doing? We have either given or pledged now 1.1 billion doses to low and middle income countries. We've given and or pledged up to $4 billion to COVAX. And importantly, we are working with the pharmaceutical companies to greatly increase their capacity over and above the demands for our country and others, so that we can essentially get doses in the tune of billions available to the developing world. So the United States, and I know everyone looks to the United States for how we're doing more and getting more doses to the rest of the world than all other countries combined. But that's not for us to stop doing what we're doing. We need to do even more. And we know for sure, as a nation, and President Biden is behind this, to continue to do what we can for the developing world.
Tony, as we look ahead, and again, this was a little bit after the beginning of PEPFAR, but both you and I, 15 years ago, were writing a lot and talking a lot about pandemics and the inevitability of pandemics. So let's jump ahead 15 years, and that's to today. What are the most important elements based on our recent history of pandemic preparedness that now, looking forward, that we must redouble our efforts on?
Well, we certainly have to use these very painful lessons over the last 20 months, not only to respond better to where we are in the midst of a pandemic, but to, even as we do that, to put into place plans for pandemic preparedness for the future. One of the things that we did quite well, Bill, was the scientific investment that we made in biomedical research, which allowed us to get a vaccine that was highly effective and safe in unprecedented record time. So we did that right. What we did not do as well was public health preparedness. We tried to have the public health global strategic security agenda, and yet we didn't really get that to the level where it should be. Our own country, the domestic public health infrastructure, over the years has actually been subject to attrition, where public health leaders retire and are not placed, public health infrastructure is not modernized. We need to do that much better. But we also need to collaborate with countries throughout the world, because as we know now and are painfully witnessing, a global pandemic requires a global response, and a global response requires global preparedness. And that's what we're looking forward to right now and over the next couple of years.
Tony, your perspective has been just monumentally important over the last 2 years, last 20 months or so. As we look back, the public's attitude towards science has changed so much. And we don't want to say everything is political and partisan and the like, but the attitude towards science has changed. You know, back when I was in the Senate, it was Republicans, or under Republican leadership, that we doubled the NIH funding. And then we jumped, a few years ahead, and it seems back that a lot of those same people today are questioning science, and there's become this more partisan divide on science. Brown University, Dr. Ashish Jha, who has attributed this in part to not having enough conservative voices within public health. And I don't want to go into the political direction, but this distrust of science and partisanship. Any comments?
Oh, yes, Bill. It is really disconcerting. And we are seeing it so clearly now. And, I think if you were back in the Senate right now, you would be having a lot of heartburn, I can tell you, because what we're seeing is a public health issue, which requires synergy among all elements of our government, where we realize that the common enemy is the virus. Sometimes when you listen to people speak, it's almost that the enemy is each other. And we have public health decisions that are based on ideologic considerations. You should never have that. You should never have looking at a map and seeing that people who are vaccinated fall heavily into one group and people who are unvaccinated fall heavily into another group. That is so antithetical with what public health should be, which should be a concerted effort on the part of the entire population. So you are right, there is an anti-science element right now that has a very strong political twinge to it, which is very, very disconcerting. I hope that when we get ourselves out of this, people will look back and realize we don't ever want to do that again because it really hindered our response to this pandemic.
You know, the fact that the big, not miracle, but you implied it a bit ago, that a lot of the research we got right, the fact that the government and private sector have been able to come together to make a vaccine in a year, which both you and I thought was impossible, 4 or 5 years ago. Will that help when your average person says, I'm alive today and my family is healthy because of the great sciences out there? Will that help, do you think, in terms of building a broader constituency for science?
I think it can and will, but we have to do a better job of communicating that because, many people, instead of marveling at the speed with which we were able to do something in an unprecedented manner, you have the opposite, that people say, well, you did it so quickly, you must have been cutting corners, instead of trying to realize the beauty of the investment of resources in science that went way back to when you were in the Senate. Yeah. I mean, the amount of support that you and your colleagues were involved with 20 years ago in getting the NIH the resources was exactly the reason why we were able to move so quickly. So it was a belief in science that has gotten us here. We've got to get that message back on the front burner to the American people.
Yeah, I don't want to keep going to the past, but you pulled it off. Our government pulled it off back with addressing HIV/AIDS with PEPFAR. We had huge bipartisan support, all built on science. And I remember that President Bush sent you down to Africa, didn't send you there, you went. But you came back and said, yes, this is doable, but it's going to take science, everybody coming together. And sure enough, we took it on. It ended up being bipartisan, trusting science. And there are probably 20 million people alive today because of that. So the fact we know it can be done, it's just getting back to it. But communication, and I want to ask really how you're doing. But before I ask that, because you've been right in the middle of this and applauded by most, criticized by some. But communication, when we were addressing it, 2005, 2006, all of us said that's probably the number one thing we need to get right. And I'm not sure any of us got it right now, but just comment on the importance of communication in the time of crisis, especially when we all don't know what the future is going to be. There's anxiety. People are frightened. How important is this whole communication? And then also, how can we do it better next time around?
Well, it is absolutely critical to everything we do, is to get the facts out to people, get them to really understand the nature of science, because, there are many people, understandably, who think that science is absolute and never changes, when and I know that science is self-correcting. As the outbreak evolved, we got more and more important information, which fashioned our response, our recommendations, our guidelines, how we approach the outbreak. We've got to be able to communicate to people to understand the nature of science. I think that would be greatly helped if, in the big picture of things, we put a lot of emphasis on science literacy and got more of our younger people interested in at least understanding science. Not everybody can or should be a scientist, but most people should at least understand what it is. And I think if we had more of that, the communication would have been much smoother. So It goes both ways.
Yeah, and I think the communication, whether it's in medical schools or schools of public health, we all can do better, those of us who are on the inside, in terms of communicating. But I think you're exactly right. Improving K through 12 education so we can all understand the basics of science, because there's going to be more and more science coming toward us every day. How are you doing with it? I don't want to overly humanize this discussion, but it's got to have been incredibly intense for you, the demands and the ongoing demands. But how are you doing?
I'm doing fine, Bill. I've been doing this a long time. My secret is to focus like a laser on what my job is and what our goal is. And my goal, as you know, you've known me for many years, is the health and the safety of the American public, against all health threats, be they the chronic illnesses that we have or the emerging infections that we have to face. One of the things that's a bit disconcerting, obviously, is that we've never had this before, where because I am representing science, I get attacked. And that's an attack on science. I mean, who would have imagined when you and I were working together that I would have to have federal agents guarding me all the time because of attacks and threats on my life, harassment of my family, my children, my wife, merely because I'm telling people they need to get vaccinated, merely because I'm telling people they need to wear a mask. Can you imagine that, Bill? That doesn't
No.
make any sense, but that's what the reality is. Yeah.
It's people ask me all the time, do you wish you were in Washington? I said, no. Look at Dr. Fauci, of all people. What advice do you have? We're coming on the holidays here, and I know we wrap things up here, but any advice to the public with respect to COVID-19, just overall staying safe, ourselves and our families over the holidays?
Bill, and that's a great question because people need to hear that. And I'm very pleased to tell them, if you get vaccinated and your family's vaccinated, you can feel good about enjoying a typical Thanksgiving, Christmas with your family and close friends. We unfortunately still have a dynamics of infection in the community of about 70,000 new cases per day. So when you go to indoor congregate settings, go the extra mile, be safe, wear a mask. But when you're with your family at home, goodness, enjoy it with your parents, your children, your grandparents. There's no reason not to do that. This will end, Bill. We are not going to be going through this indefinitely. How quickly we get to the end depends on us, how well we vaccinate, how well we get boosted, and how well we do the kinds of things to protect ourselves. So that's my message to the general public.
That ownership, the emphasis on each of us can control the destiny, and going to this pandemic to endemic, which is where we started. Tony, thank you so much. Any final words? I know we have policymakers listening to us now. We've got members of the public. We've outlined what about the holidays and what to do. Any final words of guidance for either the policymakers or members of the public?
Yeah. Well, the policymakers, I think they've got to really continue to give support to what is very, very clear is the pathway out of that. I mean, we've had very good support from the administration, apart from a few attackers in the Congress. The Congress has been really, really good about this. So just keep supporting us and we'll get out of this together. We're in it together and we'll get out of it together.
Dr. Tony Fauci, thank you for your leadership throughout this difficult and challenging time and your advice as we look ahead. Thank you for joining us today. Now I'll turn it back over to Anand for our panel discussion.
Thank you, Senator Frist and Dr. Fauci, for that conversation. Dr. Fauci, thank you for your tremendous leadership during this pandemic. And now I'm really pleased to be joined by Dr. Leana Wen and Dr. Jerome Adams. Dr. Wen is also a member of BPC's Future of Healthcare Task Force. Dr. Adams is a member of BPC's Opioid Crisis Task Force. Leana and Jerome, thanks so much for being with us today. Great to be with you.
Thank you for having us.
So we've heard now from Senator Dr. Frist and Dr. Fauci. They covered a range of topics, and I want to get your thoughts on several of them. And Jerome, maybe we can start with you with respect to where we are in the pandemic. As Dr. Fauci has noted, we've done well as a country vaccinating Americans, but we're still at a point right now where daily cases are quite high. There are about 1,000 preventable deaths occurring every day in the United States. What more do we need to do to suppress the virus? And particularly your thoughts on how to reach better the 60 million or so eligible but unvaccinated Americans. What can we do better?
Well, thank you so much for having me today. And I'd say, first of all, we need to remember it's not one tool. There's a toolbox that we now have that we need to do a better job of utilizing. Vaccinations are the strongest, the most important tool in that toolbox, but we need to continue to promote testing so that we can identify where the virus is. We need to continue to promote therapeutics. We've got wonderful therapeutics out there, but not enough people are able to access them. And again, that loops back to testing, because you can't give someone therapy if you don't diagnose them promptly. We need to continue to support appropriate ventilation. We know that that's a strong protective mechanism that we haven't done enough to support. And we need to continue to help people understand that masking is important in certain environments, as Dr. Fauci laid out. But very quickly on vaccinations, 60 million people eligible but not vaccinated. We need to understand, first of all, that this was not unexpected. We almost lost our measles eradication status in 2019. We've been seeing this occur over the past decade. And so we need to understand that vaccine hesitancy has been unfortunately growing in this country. And we need to make sure we're using political distinctions to engage people versus attack people. And I've been very concerned about how we've been using political distinctions as a bludgeon to demonize people, to attack people, and not as a way to engage people. You heard Senator Frist talk about how there's not enough conservatives involved in the conversation. I can tell you, I'm an independent, but I was seen as being part of a conservative administration. And you're often told you're not welcome to these conversations if you're a conservative. We don't want to work with you. That's the message that a lot of these unvaccinated people who lean right are getting, and that pushes them away. It doesn't engage them. Finally, we need to understand the root causes, and it's not political affiliations, it's mistrust, and it's lack of access to accurate information. If you're an African American, mistrust that goes back decades, back to Tuskegee and Henrietta Lacks, and it's still going on right now. If you're Hispanic or Latino, mistrust that's related to concerns about whether or not your immigration status is going to be at risk. If you live in parts of America that feel they're disconnected from the political leadership, that mistrust can occur for other reasons. And so keys are reaching local surrogates, local people who can help build that trust. Doctors, pharmacists, local surrogates, the more we can empower them with the facts, the more we'll be able to transmit those facts to the people who are unvaccinated. Number one predictor of being unvaccinated, lack of health insurance. These are people who don't have someone they can go to who they trust. We need to make sure we're bridging that divide.
Great points, Jerome. Thank you. Leana, your take. As Jerome put it, it requires many different elements to suppress the virus: testing, therapeutics, masking, vaccinations, obviously critical. And your thoughts, Leana, specifically on the vaccination front. It does seem over the last few weeks, few months that the Biden administration has slightly pivoted from persuasion to mandate to try to increase vaccination rates, particularly with respect to large employers, employees, healthcare workers, federal government employees, and contractors. Now, some of these regulations are caught up in the courts, but they may be having their intended impact already. Can you talk a little bit about sort of the strategy of vaccine mandates and, of course, OSHA's emergency temporary standard as we try to increase vaccination rates, one part of the important tool that we have?
Of course, and I'm glad to be joining you and Jerome today for this important conversation, and definitely want to agree also with what Dr. Adams just said in terms of, first, the importance of testing in getting us through this period of the pandemic. I mean, we have to accept at some point that we're not going to eradicate COVID. We have to figure out a way to live with it. Vaccines are a critical tool for us to do that. And testing, along with these other tools, including masking and crowded indoor spaces, will be an important method to get us to this point of moving from an existential emergency of COVID to something that we have to learn how to cope with. And I thought that the conversation with Dr. Fauci about how vaccines have really changed the landscape, that last Thanksgiving, last Christmas, last New Year's was very different from this one because of the advent of vaccines. And so I do think that we're getting to this new phase where we have to figure out how we can come to terms with COVID in our reality, but we can actually do the things that we want to do and see our loved ones again. That's really different compared to last year because of these safe and effective vaccines. But Anna, this is getting to your point about where we are with vaccination. I really wish that we didn't have to be at a point where we have to even talk about vaccine requirements, right? I mean, I wish that we didn't have distrust, as Jerome was talking about. I wish we didn't have misinformation and disinformation to the point that people don't believe in the fact that we now have these safe and effective vaccines. I wish that the education and outreach that was done was sufficient and that we would have reached a point where we don't have these preventable deaths due to people remaining unvaccinated. But unfortunately, that is not where we are. You know, I wrote a column for the Washington Post last week where two of the people that I interviewed were Dr. Scott Gottlieb, from formerly of the FDA, and Dr. Lawrence Gostin from Georgetown, who is a professor of global health law. And Professor Gostin and I talked in particular about how mandates they could erode trust in public health when you make people do something that they don't want to do. But at some point, they may also be essential for the public's health. And so how do you reconcile that? And I think that this is the point that we're at now. We know that vaccine requirements, including in the workplace, do work. We've seen entities like Tyson's Foods, for example, reach over 96% of all their employees being vaccinated. We saw United Airlines, after instituting their vaccine requirement, that they were able to get to the high 90s percentile. And the United CEO thinks that having the vaccine requirement in place is actually a recruiting advantage because it signals to potential employees that they really care about worker safety. I mean, there's a real reason why vaccine requirements are needed at this point in the pandemic. But we also have to recognize the political risk that might entail. And I do worry, just to conclude, that there are long-term effects to public health because of the fact that things that should never have been politicized, like masks and vaccines, are now in these ideological crosshairs, in the middle of culture wars, if you will. And I worry about the long-term impacts, not just for this fight against COVID, but could it actually make us, paradoxically and tragically, even less prepared for the next pandemic?
And Anand, can I jump in really quickly, because that's
Yes, please.
That's an important concept that Dr. Wen laid out in her op-ed. I want people to understand that from a public health standpoint, mandates are effective at getting more people vaccinated. From a public health messaging standpoint, and this pandemic has been interesting because there's a political element to it that we haven't seen previously. It's important for people to understand that mandates that don't come with a healthy dose of engagement and education, to Dr. Wen's point, can be harmful to us in the long run. So I advise a lot of employers, businesses, and schools, and here's what I say to them. I say to them, you need to make sure you're surveying your constituents, your employees, and that you're framing this not as a vaccine mandate, but as a workplace safety mandate. And what's interesting, and I've tweeted about this and talked about this frequently, in most cases, you do have the option not to get vaccinated. It's just that your life is going to be a whole lot harder because we need to do other things to protect the workplace. We need to make sure you're frequently tested. We need to make sure you're wearing a mask at all times. But again, it's not so much about the vaccine itself, which has been politicized in some quarters. It's about creating a safe workplace. And I would tell anyone running a workplace that you do have an obligation to create a safe workplace. And some places have said, we're going to vaccinate people, and that's the only way we're going to do it. But other places have taken a more inclusive approach. It is a workplace safety mandate that is appropriate, and we need to make sure we can reopen safely. At Purdue, we actually didn't pursue a mandate early on. President Daniels at Purdue University aggressively reached out to the students. and the faculty and said, look, we want to stay open. We want you to be able to have in-person class. And here's what we need to do. We need to mask. We need to make sure we're getting our vaccination rates up. And we actually have seen that we got over 90% vaccination on campus without a mandate. So you can get there. The real key is engagement. And if you fail at engagement, then the mandates, to Dr. Wen's point, may actually do more harm in the long run than good, even though they are an effective tool to get you over that last mile once you've done the engagement.
If I could add to this point about mandates, I actually, part of my column, in fact, was talking about how we need to turn down the temperature on vaccine mandates. And in fact, the OSHA requirement, Anna, that you were referencing, in essence, it could actually be reframed as a testing and masking mandate, because that's what it is, right? It's saying that
Exactly.
there's an obligation to keep the workplace safe. And so we are requiring that everybody is tested on a regular basis and they have to wear a mask. But I think that the Biden administration could say, but you can opt out if you're fully vaccinated. So in a sense, this is like saying everybody has to go through, when you go to the airport, you have your ID checked and you put your things through the security line. But if you have TSA pre-check, you don't have to do all these things. It makes your life easier if you have that thing. I actually think that we can reframe vaccination as that TSA pre-check, or the easy pass, if you will. And so it's not that you're forced to be vaccinated, but rather that this is a path to opt out of that other more cumbersome process. And the end goal is not to get people vaccinated, right? I mean, that is not the end goal in public health, is vaccination. The end goal is to stop the scourge and the tragedy due to COVID-19. And I think we should focus on that as a goal that we can unite behind.
That's great. Excellent points on framing. Leana, I want to talk about sort of vaccinations, but for children. So sort of the other end of the spectrum for a moment, because that's the other sort of significant development that's ongoing now. 28 million children aged 5 to 11 now eligible for vaccines. On a personal note, yesterday I took my two daughters, aged 10 and 8, to get their first dose of COVID vaccine. And I'll tell you, it's a momentous moment for us as they prepare to visit their grandparents in Michigan over the holidays. Talk a little bit about the importance of vaccinating kids, for parents, for families, as well as in the fight against this pandemic.
Well, I'm very happy for you, and I'm also quite envious as well, as I have two little ones, a 4-year-old and a 1.5-year-old, who are not yet eligible to be vaccinated. Dr. Fauci laid out, I thought, very well in the Q&A earlier with Senator Frist on how we have to really debunk this false narrative that somehow children are immune from COVID-19, because it's just not true. I mean, we're talking about tens of thousands of young children who've been hospitalized, dozens, if not more than 100, who have died in this age group from COVID-19. That COVID has come out of nowhere in the last 2 years to become a leading cause of death, a top 10 leading cause of death in children of this age group. And so, yes, there is a societal impact of having 28 million kids in this 5 to 11 age group who are now newly eligible to be vaccinated. But I actually think that the real benefit is going to be for families. I mean, Anna, there's so many families like yours, and that I know, and that we treat in our clinical practice, who have been putting their lives on hold. Parents who are really worried about going into in-person work because they don't want to come back and infect their children. Kids who have been going to school, especially in areas of the country that are not requiring masking in schools or don't have other precautions, whose parents every night are praying that they don't get infected in schools. Kids who have been pulled out of extracurricular activities and are not going and have not been able to do the sports that they love, or have not been going to sleepovers with their friends for fear of COVID. I mean, we can all agree, I think, that COVID has been really hard on our children, and getting the vaccines to them allows them to regain that sense of normalcy that I think is so important. And of course, the knock-on effects of potentially vulnerable family members who we haven't been able to visit. I mean, there are real tangible reasons for families to get their kids vaccinated. And I'm so glad that that we're now seeing a lot of parents who are the early adopters do this. And I hope that more families will share their stories of these, who are the early adopters, will share their stories of how safe the vaccines are, but also how they are allowing a return to pre-pandemic life. I think ultimately that is what's going to get us through this messaging difficulty of getting more parents from the wait and see group to the vaccination category. I think what it will take is for those early adopters to share their stories.
And Anand, I think it's important, to your point, we were having this conversation. I got my 11-year-old daughter vaccinated last week, that we reframe this discussion just as we reframe or need to reframe the discussion on vaccine mandates. It is tragic, as Dr. Wen laid out, that we have over 600 children who died from COVID in this country. Truly tragic. And children hardly die of anything. So that 600 number is a big number, even though it doesn't seem like it to the average person. That said, from a public health communication point of view, we have to understand that the majority of people out there in the United States now are more likely, far more likely to know a child who has gotten COVID and been just fine than they are to know a child who has gotten COVID and died. That is just a statistical fact. And so we aren't going to scare people into getting vaccinated by saying your child could die. We just aren't from a messaging point of view. So Dr. Wen laid out very quickly these points that I think we need to stress when we're talking about why we got our kids vaccinated. They prevent infection in the child's network and protect other children and adults. Thinking about the holiday season, going around grandma, grandpa, aunts, uncles. They prevent school outbreaks and closings. And that was a big reason my own daughter wanted to get vaccinated, because she's seen her classmates have to quarantine, have to be home from school. Many parents, most parents around the country have actually seen that negative outcome of not being vaccinated. They preempt the need for masks and other mitigation in schools. Again, incredibly important, something all of us have seen. And then we need to talk more about long COVID, particularly in kids. This scares me. It's not all about dying. It's about getting COVID and not knowing whether or not your child is going to have long-term negative impacts on their cognition, on their physical health, on their ability to be a kid, because you thought they'd be just fine if they got COVID. We need to emphasize these other benefits of being vaccinated and not make it all about you're going to die or your kid's going to die if they don't get vaccinated, because that message, it's just not resonating. It just doesn't fit with what people are seeing around them.
That's great. Very, very helpful. I want to just slightly shift gears to pandemic preparedness. And I must say I was quite heartened in the conversation we heard between Senator Frist and Dr. Fauci a moment ago. That Dr. Fauci mentioned, in terms of the lessons learned of the pandemic, the first thing that he mentioned was really the need to focus on public health. And I have to ask the both of you, as local health official, Leana, and a former state health official, Jerome, have we finally learned our lesson about the important role of having a robust public health infrastructure and supporting public health in this country, whether it's an existing threat that we have or an emergency like COVID? What is COVID-19? What has it taught us about the importance of public health, and has the nation learned that lesson?
Well,
Jerome, if you want to start first. Yeah.
I'll jump in first and then let Dr. Wen take it home. I'll be frank, we haven't learned our lesson, and the numbers prove it. We've had more people die this year from COVID than died last year, with more tools at our disposal. We tend to have this approach of putting out fires, and then we put out the fire and forget all about it, and then we don't prepare for the next fire, or we do things so specific to one disease. The fact is, the US actually did pretty well, or at least pretty comparable to the rest of the developed world in terms of infection rates from COVID. Where we did horribly was that once you were infected, we had far more people die from COVID in the United States compared to Europe, for instance. And that's because we have such high rates of comorbidities, obesity, hypertension, smoking, other things that put you at higher risk for negative outcomes whenever there's a pandemic of any infectious disease. And I'm worried, quite frankly, that we haven't learned the lessons, that we haven't really come to the place where we understand we have to invest in public health. We have to invest in a public health workforce. We have to invest in chronic disease prevention. We have to invest in the things that we know will create opportunities for people to be healthy, like complete streets and transportation and housing. All these things are really the reason why we saw these horrible outcomes from COVID. It's not as much about the virus as it was about our resiliency or lack thereof in this country. And so I think we have an opportunity. I don't want to be negative. I think we have a real opportunity, but I think we're at a point right now, an inflection point, where we have to really start to focus on those underlying cracks in our foundation that really set us up for poor outcomes from COVID, and not just make it all about COVID or all about the moment, and really understand that it is truly all about the lack of attention to public health and public health infrastructure that's been taking place over decades, and that Dr. Wen and I and our colleagues have been warning people about for most of our careers.
Yeah, I really agree with you. Of course, this should be no surprise. I think all of us who are former local state health officials would agree that public health infrastructure has been decimated over the years, that we as a country just do not pay attention to prevention, that there is this focus on what happens at the end of the road. And I'm an ER doc. Dr. Adams, I know, works in intensive care areas where, of course, we believe that if you're ill, you should get the best treatment possible. But there should also be this focus on prevention and on social determinants of health that I think many people watching will be sympathetic to. But that focus has not been there over the years. And actually, one of my fears is that coming out of COVID, not that we're out of it, but as we're learning lessons from it, I don't want for public health to be equated with COVID-19. I don't want public health to be equated with infection control. Yes, that is an important component. But there are two things. One is that there are these other issues that we need to be attentive to: chronic diseases, the opioid epidemic, mental health, issues that existed as crises before COVID. And if anything, have gotten worse. They were unmet health needs before. They haven't gone away just on their own. We need to continue to double down on these issues. And I want the attention and the focus to be on them too. But there's another aspect as well, which is that because COVID has been, unfortunately, so politicized, as we've talked about, I think that equating public health to COVID can have effects that are long-lasting, that are unintended, but really pernicious and really dangerous. I mean, we've now seen, for example, legislatures across the country pass laws that are restricting public health authority. And so if you are now allowing the local public health official to be issuing quarantine, what happens if in the future they have a case of multi-drug resistant tuberculosis and they can no longer quarantine this individual? Or what happens if there's a new virus of some kind and now that local health department cannot issue a mask mandate to try to stop that spread? I mean, I do worry about public health, again, being in the crosshairs of this partisan divide in a way that it has not been before. And that's another reason why I hope that we'll take a step back and not just see public health as being everything COVID. I don't mean that we shouldn't focus on vaccines and masking and reducing deaths from coronavirus, but rather that we really need to step back and have this broader view on the life-saving and life-changing impact broadly of public health too.
Great. Terrific comments. I see a few questions coming in from the audience, so this is your time to ensure that you ask your questions so we can get them answered. And while the questions gather, maybe Leana and Jerome, we can go to probably one of the most important questions for the public, and Dr. Fauci started to talk about this, but what advice do you have for the public as we get into the holidays and people start to travel and visit their family and friends, and what's your advice on how to stay safe during the holidays? Leana, if you want to start.
Well, I would say that every family first they need to assess their own risk and their risk tolerance. A family in which everybody is generally healthy and fully vaccinated might take very different types of risks than a family with unvaccinated young kids or elderly immunocompromised family members. People's risk tolerance will also differ as well. And so I think taking that into consideration is important. very different to last year because we have the protective effect of the vaccines. I think it would be a reasonable decision for many families to make who will say, hey, we will gather with other loved ones indoors and have a normal Thanksgiving again, or normal Christmas or New Year's or other holidays. I think that is a reasonable decision to be making. On the other hand, family members with more vulnerable family members or who also have a lower risk tolerance may say, we still want to gather outdoors as much as possible, especially if there are a number of unvaccinated, let's say, little kids around. Or if we're going to be indoors, we want everyone to be reducing their risk for a 3 to 5 day period beforehand, and then taking a rapid test the day of the get-together. That, for many people, may sound like it's over the top and abundance of caution, but that is what my family is doing when we get together with a number of other families over Thanksgiving and we're going to be indoors. We are asking everybody to reduce their overall risk for the 3 to 5 day period before. We're all taking a rapid test the morning of. Now, again, I think this is, every household is going to have a different way of assessing their own risk and managing their own risk. But I think at this point in the pandemic, we have to recognize that there is no clear-cut, one-size-fits-all answer, that we're all going to be making decisions that are best for ourselves and our families. There are steps we can take to get back to normal while still trying to keep safe as well. Vaccination, masking in crowded indoor spaces, testing, all these are important tools, as Dr. Adams said earlier, important tools in our toolbox to help us to get back to normal and do those things that we most enjoy.
And I'll be quick. I'll just foot stomp some points that Dr. Wen brought up. But I want to say something and reiterate something Dr. Fauci brought up. And that's that we should be hopeful. We should be thankful. We should be very appreciative that we have so many more tools this year than what we had last year. And that will allow us to have a much more normal, a much more traditional holiday season this year. We need to balance that against the fact that we know the virus likes when people come together, especially from all across the country. We know the virus likes cold weather, which forces individuals next door or indoors. We know that cases are leveling off and or increasing in certain parts of the country. So we really are going into a headwind, and we should be prepared for that. So we know that we've got challenges. We know we have tools. We need to utilize those tools. As Dr. Wen said, I have 3 steps: know your risk, your own personal risk, understand your circumstances, outdoors, indoors, bringing together people who have comorbidities or not, and then take measures to stay safe. The number 1 measure you can take is to make sure everyone coming in your household is vaccinated. And the number 2 measure you can take is to make sure everyone coming into your household is asymptomatic, does not have symptoms, because even if you're vaccinated, if you're coughing, if you're sneezing, if you've got symptoms, you still could be spreading the virus. Then you can use some of these other tools like home testing kits, and they're becoming more and more available. We did see a severe shortage of them, and there is still a shortage. But I've got testing kits, and my plan for the holiday season is: A, are you vaccinated? B, do you have any symptoms? And C, if you have symptoms and or if you're not vaccinated, then we need to make sure you get a test before you come into our environment. And when I say symptoms, I mean things that could be mild, like allergy symptoms. If you've got a fever, if you're coughing, if you've got a sore throat, you need to stay home for the sake of the family.
That's great. Terrific. A couple of questions have come in, and I'll just read them out, and then feel free to answer whichever ones. One is on personal safety. To your points right now, I'm elderly, excellent health, fully vaccinated and boosted. Is it safe for me to dine indoors? One question on framing. We talked a lot about framing and vaccines, but isn't there just as much pushback in some quarters to masking as there is to vaccines? What can we do about that? And a final question on public health. When we talk about the importance of investments about public health, the legislators, how do we do so when the outcomes of the investments may not be seen for years? So a couple of questions there: public health, personal safety, and framing vis-a-vis masking, if either of you want to take some of those questions.
I want to grab one because I want to get Dr. Wen's take on this too. And an important thing for people to understand is Dr. Wen and I have done panels like this frequently. She's seen as leaning left. I'm seen as leaning right. At the end of the day, when we get together, it's not about right or left. We just talk public health. And you've seen that we agree more than we disagree. And so I love bouncing things off of her. And as far as masking, I'm going to say something controversial, but I believe that masking is becoming less and less, and it's still a great public health practice, but you see more and more of the country getting away from mask usage and mask mandates. And so I think it is incredibly important to emphasize that as a tool, but to understand the reality that we're in right now. And that means that we have to rely on other tools that much more so. That's why it's even more important if you want to get together with your family unmasked, that everyone is vaccinated, but not just vaccinated. We didn't talk about this, boosted. 80+% of people out there who are eligible for a booster because they're likely to have waning immunity have not been boosted yet. That is something incredibly important you can do going into the holiday season, is make sure you're using that tool. Again, home testing, make sure we're using those tools. I don't want to say the train has left the station on masking, because it's still an important part, especially in public settings across the nation. But I do feel like we need to change our strategies to really focus on other tools where we are likely to have greater uptake and increasing uptake, versus putting all our eggs in the mask basket with the knowledge that the country's moving away from masking. And I'd love to get Dr. Wen's take on that.
Yeah, and actually, Jerome, I will add to the first part of what you said as well, which is that I am also an independent, and I think for us, this is maybe one of the reasons I so appreciate working with the BPC,
Exactly.
and also with you too, Jerome, is that we're not here to stake out a partisan position. That's not the work that we do in public health. We're here to work with everyone, right? Part of working in public health is knowing that public health depends on public trust. And our job is to promote public health for everyone. And that involves working with people no matter what other affiliation they might have. And so I appreciate the conversation and the kind of the pragmatic approach that we're taking to various policy conversations, and to obviously to helping people navigate their own lives. It's interesting on masks. One of the things that I've been emphasizing for a while now, and not everybody agrees with this, but it actually, I think, maybe dovetails with Dr. Adams. The point that you just made is that we don't come from a country that has a mask wearing culture. And for many people, rightly or wrongly, I mean, this is no judgment on this, except to point out that many people really do not want to be wearing masks. And I've been saying for a while that we really need to talk about vaccines as a replacement, as in we see all these various tools, yes, as tools in our toolbox. One of the other analogies I like to use is as layers in the winter. If you're cold, right, you have to put on many layers. And if it's really cold outside, meaning if there's a lot of virus around you, you might need to have a lot of layers. The vaccine is this really excellent coat. It is the best protection, if you will, against this inclement weather. If you have the protection of the vaccine, it would be reasonable to remove some of these other layers. Many people do not like the layer of masking, especially of mandatory masking. And it would be reasonable, I think, especially as, for example, kids are getting vaccinated in schools, to be able to say if every child in a classroom is vaccinated, they may no longer need to wear masks. If everyone in a workplace is vaccinated, they may no longer need to wear masks. I do think that adding that incentive of here's what you get if you're vaccinated, which I think to some people, it's hugely offensive, because they're saying, why do you need an additional incentive? Isn't vaccine saving your life? Isn't that enough of an incentive? But I also think that there's some people who are on the fence about getting vaccinated, but who, if that the incentive of now you don't have to wear a mask, I think that will be really powerful. And then I think it comes down to weighing personal risk. There are some people who are immunocompromised, who have underlying medical conditions, who may, by their own choice, always be wearing a mask when traveling on planes or trains, or myself, for example, going to the grocery store when I have unvaccinated young children. I just don't see this as a much of an imposition to be wearing a mask in crowded indoor spaces. But I think allowing people who are vaccinated the option to not wear a mask, I think will actually be hugely helpful in the framing, if you will, as we move forward and talk about the protective effect of these great vaccines.
Great. Well, we're almost out of time. We have about a minute left. So I do want to just ask this very final question, maybe 30 seconds from each of you. Your forecast for 2022. Obviously, 2022 will be a big year in the global fight and ensuring that we get worldwide more people vaccinated. We're going to be on the lookout for variants, of course. But as Dr. Fauci mentioned, this pandemic will end. We'll learn to live with the virus. What's your, maybe in 30 seconds, Jerome, we'll start with you, your forecast. How does 2022 look for you with respect to COVID-19?
Well, I'm hopeful. I'm hopeful because we have more tools than we've ever had before. You're now hearing about oral antivirals coming out and adding to the toolkit. We're seeing more and more people being vaccinated. The fact is it's leveled off, but it's still slowly going up. And unfortunately, many people are continuing to get some degree of immunity simply through the exposure to the virus. I'm terribly concerned that we're going into an election year. I really am, and I'm concerned that the virus will continue to be politicized for other agendas. But I say that because I want everyone watching to understand we have the tools to contain this virus and learn to live with it and make it much less of an imposition on our lives. But it's on us. It's on us to use those tools to put the politics aside and make 2022 even brighter than 2021 has been as we've become more and more accustomed to this virus.
I'll add that if it's anything that we've learned in the pandemic, it's that the future is not preordained. The future is very much up to us and what we're able to do. We have the incredible benefit now of science. I mean, in this pandemic, science has really delivered. Science delivered on the vaccines. Science is delivering on oral treatments, as Dr. Adams just mentioned. And I think we are getting to this point where we are able to live with the pandemic. We need one more thing, actually a couple more things. We need vaccines for even younger children, speaking selfishly as a parent of young kids here. And we also need a lot more widespread testing because I would love to get to the point that other countries have gotten to where there is widespread free testing and testing becomes the norm before people enter crowded spaces, before they get together with individuals. I do think that, ending on a hopeful note, that we will get to a point, ideally even as soon as the spring, where we're really able to learn to live with the pandemic so that it is not this existential crisis all the time in our lives. How this portends, though, to other aspects of public health, I'm not sure, but I do know that it's going to take all of us to try to turn down the temperature and really focus on what unites us, which ultimately should be enabling everyone to have a healthier and better future.
That's a great note to add. And let me, Dr. Wen, Dr. Adams, thank you. Thank you for your leadership, in particular, communicating to the American public these last 18 months about the pandemic. Thanks for being with us today. I want to thank the audience for your participation, your questions as well. Hopefully, this has been informative. And as Dr. Fauci said, we're all in this together, and together we'll get through this. So everyone, stay safe, take care over the holidays, and we'll talk to you soon. Thanks, everybody.
Thank you.